So please do make yourself nice and comfortable, take a seat. Promise everything today is going to be very stress-free and hopefully relaxing for you, if anything. But if you do have any concerns throughout, then don't be afraid to let me know. I really do want to prioritise your comfort and to ensure that you're at ease throughout the whole exam. Alright? Now before we get started, do just have a few personal details to gather from yourself. So can I just confirm your full name? Great. And your date of birth? And your current address? Great. Can I take a contact number? Great. And can I also take an emergency contact detail as well? So a phone number, the name of that person, and their relation to you. Wonderful. Okay, and have you got any medical conditions we should be aware of? Okay, and any family medical history we should be aware of as well? Okay, and any allergies? No problem. And have you had to visit the emergency room in the last 12 months? Okay. Any surgery in the last 12 months? Okay, and have you been experiencing any unusual symptoms or any illness in the last sort of 2 to 3 weeks? Okay. And are you all up to date with your vaccinations? Okay, wonderful. Now, what is your weekly alcohol intake looking like currently? Okay, and are you a smoker? Okay, and how much physical activity are you getting weekly? Wonderful. So that's everything I need from you at this point, which means we can go ahead and get started. Just put on some gloves first of all. Let's start by taking your temperature, just to check that you haven't got any fever. What we're going to do is just place this under the tongue, so if you just open wide for me. Thank you. Wonderful. Okay, and let's listen to your heart. So I'm just going to put this onto your chest. To apologise if it is a little cold. If you could just breathe normally for me. Good. Good. just working my way down to your chest, listening to the breathing. You can just breathe normally for me. Good. And now take a big deep breath in and hold. And exhale. Good. Okay, can you also cough for me now? Good. And once more. Fantastic. Okay, just gonna feel your pulse as well. Let's go ahead and test the reflexes in your knees. So just have this little tool here. I'm going to be lightly jabbing just below the kneecap. So if you just relax for me. Good. Amazing. I'm just going to take your blood pressure now, so I'm going to pop this around one of your arms and gently inflate the band. Okay, so it will feel a little tight, a little build up of pressure in the arm, but nothing that's going to cause you any pain, I promise. Fantastic. Okay. Coming up closer now to have a look at the face. You can see that the skin is looking nice and healthy, which is great. Do you ever struggle with sensitive skin, or is there no concern there? Good, okay. Let's feel the glands in your neck now. Is that causing you any pain, any discomfort at all? Good. Fantastic. Okay, if you could open nice and wide for me. Good. And say, ah. Thank you. And again, say, ah. Good. Okay, nice. So let's have a look at the eyes. Can you blink for me? Good. Blink. That's it. Okay, good. I just want you to focus on me, ignoring that light. Good. Before we continue, is that causing any sensitivity, that light? Good, okay. So, just want you to look up now. Can you look up? That's it. And look down. Look over to your left. Good, and over to your right. And back at me. Good. Again, look up. Look down. And over to your left. And over to your right. And back at me. Good, okay. Can you just follow the pen as it comes closer? That's it. And further away. Good. Closer. And further away. Good. Closer. And further. Good. Okay, now just following that light. Follow. Good. Following the light. Okay, can you tell me how many fingers I'm holding up? Good. And now? Good. And now? Good. And what about over here? How many fingers am I holding up? Good. And now? Good. And now? Good job. Let's do a quick vision test now with the chart. So, can you start from the third line down, reading from left to right? So this letter here. Good, and here. Good, and here. Amazing. Let's go down to this fifth line, starting with this letter here. What's this? D. Good, and here. Here, here, good. And can we go down to this line then now? So starting here, E, good, and here, B, good, here, good, and here, good. Okay, going down to this line, starting from the right side this time. Can you tell me this letter? And here. Good. And here. Good. And here. Good. And here. And let's do that bottom line. Or try to do that bottom line. You're doing really, really well so far. So this letter, please. Good. This letter. This letter. This letter. This letter. Good. Good job, my darling. Okay. So moving on now to have a look. Those ears. So over in this ear first. Can you hear me nice and clearly? just going to give those ears a quick clean, just where they are looking a little waxy, and really good that you're not cleaning them yourself, because you should always leave the cleaning to a professional to make sure that you're not going to cause more harm than good when cleaning them yourself. Okay, so I'm just going to be using very gentle swabs to clean. And over in the other ear. Alright, now just going to carry out a quick physical exam. Right, let's start looking at the shoulders, the neck. Are you feeling any pain here at the moment? Some touching, or just generally any sort of muscle tension, pain in the joints at all? Good, okay. And just feeling your stomach now. Same question, are you ever experiencing any digestive health issues, any problems when going to the bathroom or immediately after eating food? Okay, good. And is this causing any pain at all? Good, okay. Alright, well if that does change then please do let us know. Alright, but overall looking really healthy, and I'm really pleased with the outcome of today's exam. So I'm just going to take my gloves off and we can summarise your notes on file. Keep losing my pen. Okay, so abnormalities and okay, wonderful, my darling. So that is everything for today's checkup, and like I said, everything is looking absolutely fine, which is great. But if anything does change or you have any new concerns, then you know where to find us. Okay. Now, thank you so much for coming in today. It's been my pleasure taking care of you. I look forward to welcoming you